So this is the Medicare Wednesday Lunch and Learns, and this one is on Medicare Supplements and Medicare Advantage. And I see there's a typo here that says open enrollment from October 15th to December 7th. That should be 2022, not 2023. I'm sorry. So our talk this afternoon is going to look primarily at Medicare Supplements and Medicare Advantage and try to begin to sort out the differences. Probably some of you already are quite familiar with them, but if you're not, why, we'll hopefully add a little more clarity this afternoon. So we have lots of people who kind of feel like this gentleman in terms of Medicare, all their different parts, questions about it, deadlines, penalties, what do I do? The most important thing to remember about Medicare is that Medicare has parts, as you can see over here, A, B, C, and D, and insurance companies have plans. So we have Medicare Advantage plans, we have prescription drug plans, and we have Medicare Supplement plans. So anytime we're talking about Medicare, make sure that you know whether you're talking about Medicare parts or whether you're talking about plans. And especially if you're talking about Medicare supplements, because some of the supplements use the same alphabet of A, B, C, and D. So that just makes it even more confusing. So let's start out and quickly look at an overview of the parts of Medicare. So we have 4 parts, as we just said: hospital coverage, medical coverage, Medicare Advantage, which is Part C, and prescription drugs. Specifically then, Part A covers inpatient hospital stays, care in a skilled rehab or nursing facility, hospice care, and home health care. You do have to have a 3-day stay in an inpatient hospital to take advantage of the skilled rehab and the skilled home care. If you are in the hospital, the Medicare Part A does not pay your physician, but rather that is paid under your Part B. Your Part B then covers doctor services, covers outpatient care, such as labs, x-rays, ambulances, emergency rooms, chiropractor, those kinds of things. Covers medical supplies, which is things like wheelchairs, oxygen, hospital beds, that kind of thing, as well as diabetic supplies. And it covers preventive services. Those new to Medicare will cover one-time annual physical. Otherwise, it covers annual wellness exams, screenings like for mammograms and pap smears, PSA tests, as well as vaccines. Part C is what's called all-in-one alternative to Medicare. And so it includes A and B and D all in one plan. You sign your Medicare benefits over, if you will. You don't exactly sign them over, but Medicare pays the Medicare Advantage plan a capitated rate to be able to provide the care for you. And they add services frequently like dental or vision or over-the-counter services. And then Part D is prescription drugs. This is a quick 1-page overview of the basically the costs and the benefits. So Part A for 2023 will have a $1,600 deductible for every 60-day benefit. Part A premium is free to most people. If you have less than 40 quarters of Social Security, there is a fee. If you are in the hospital more than 60 days, there is a $400 copay for days 61 through 90. And an $800 copay for days 91 forward. If you have to go to a skilled nursing facility, days 1 through 20 are free, and then it's $200 a day for days 21 through 100. Again, assuming you need skilled care. If you do not need skilled care, then you pay out of pocket. And on day 101, if you need that much skilled care, you will have to pay out of pocket. Medicare will no longer pay. Medicare Part B will have a $226 deductible in 2023. The Medicare Part B premium is going to decrease from $170 to $164. And under Medicare Part B, basically Medicare pays 80% of the charges, and you have to pay 20%, which is why many people will opt to buy a Medicare supplement, because the Medicare supplement will pay the difference of this 80%, as well as you will have to always pay on the Medicare supplement this deductible of Part B. That is no longer covered under any Medicare supplements. It looks different under a Medicare Advantage. If you buy a Plan G Medicare supplement, it will also pay this $1,600. It will pay this $400, pay this $800, and pay this $200 per day. So it will cover a Medicare Supplement Part G. That'll make more sense to you later. Will cover everything in A and B except this $226 and the Part B premium. Under Medicare Part C, these deductibles and copays are going to look different, and we will discuss those as we go through this. Usually on a Medicare Advantage plan, what you will have to pay is this $200 a day for the skilled rehab from days 21 to 100. And some of these outpatient services have a flat fee, and some of them you'll pay the 20% copay. Under the prescription drug plan, which again, if you have a Medicare Advantage plan, you will have to pay, or that will be included. If you have a Medicare supplement, you will have to buy a standalone plan. And in 2023, there are 23 different plans offered in Colorado. They're offered in every county in Colorado. The cheapest plan is $3.50, which is a WellCare plan. The most expensive, I believe, is $129 per month, and that is an AARP plan. The copays vary by tier, as well as which prescriptions are on the formulary and at which level. So that's a really, really quick overview. So we'll start into the specifics now about making a decision. So this is just a little graphic that says if you stay in original Medicare with fee-for-service, you have Medicare Part A and B, and then you can add a Medigap or a Medicare supplement, and you should always add a Part D prescription drug plan. If you don't want to go that route and you want to go the route of the Medicare Advantage plan, you can do the Medicare, which is managed care. You do Part C, and then that's inclusive of A, B, and D. So let's talk a few minutes about a Medicare supplement. A Medicare supplement, basically, you have the ability to choose your own doctor and network. You can go to any hospital or any doctor in the United States as long as they accept Medicare. You do not have to get a referral if you are in a Medicare supplement. If you decide you want to go see a cardiologist and you have the name of one, you can make your own appointment and you just go. In a Medicare Advantage, most of the time you will need a referral. It is guaranteed renewable. And what that means is that you could use $1 million worth of services in 2023, and the company cannot drop you unless you don't pay your premium. The other thing on a Medicare supplement is you pretty much, especially if you know, if you buy a Plan G, you know what your costs are, your Part B deductible and your annual premium. Other than that, there are no out-of-pocket expenses. The Medicare supplements are also standardized. So when you buy a Plan A, a B, a G, they look all the same, regardless of the company that you buy them from. You can buy them from United, you can buy them from Mutual of Omaha, you can buy them from Humana, State Farm, doesn't matter. You are free to, as I said a moment ago, to choose any doctor that you want, and you have very predictable costs. Other features of a Medicare supplement is that the agents must give you a disclosure form. If you are new to a Medicare supplement, then they still have to fill it out. If you're changing Medicare supplements, they have to fill out a form approved by the Colorado Division of Insurance to basically keep from you having multiple plans that don't pay. They have a 30-day fully refundable premium. And in this instance, your healthcare decisions are basically made by the Medicare agencies that Medicare contracts with to make healthcare decisions rather than the health insurance company. Claims are submitted by the provider, whoever that happens to be, the doctor, lab, x-ray, to Medicare for payment. And then once Medicare has paid, then Medicare sends the payment information that they have made to your insurance carrier, and then they pay the balance. And the rates are approved annually by the Colorado Division of Insurance. Rates are determined in a couple of different ways. They are determined if you have attained age, community age, or issue age. The majority of the companies in Colorado use what we call attained age, meaning that if for people 65 to 69, there's a specific break in terms of what the premium is. And then usually from 70 to 74, there's another premium. So the majority of them in Colorado are, if every 65 to 69-year-old is going to pay the same basic rate for a specific company. Now, each company is going to have their own rates, and they will not be consistent across companies. They're allowed to use whether or not you're smoking or non-smoking, male or female, and there is some variation depending on where you live in the country, or I mean in the state. And then based on all of these criteria, then the Insurance Commission allows the rates to be determined based on what they call loss ratios, which means how much money they spend out. So this is just a little graphic that shows your doctor or provider. Basically, they provide the service, they bill Medicare, and then Medicare pays 80%, and then they send it on to your Medigap. So these are the standardized plans that I was talking about. So again, here are the plans A, B, D, G, K, L, M, and N. The one I recommend is G because it has the most comprehensive coverage. Premiums tend to be a little bit higher than some of the others, but you get all of the coverage. So as I said a moment ago, they pay the A and B co-insurance, pay the hospital deductibles, pay for blood work, hospice and skilled nursing co-insurance, A and B deductibles. This is a really important one from my perspective, which is the excess charges. That's the difference of what Medicare allows on the 20%. Some providers will accept the 20%. Some will charge an additional 15%, and G pays that as well. This is just a list of all of the companies in Colorado that provide or sell Plan G. And what I always tell people is we buy Medicare supplements not because there's one company's going to pay better than the other, because by federal law, they all have to pay the same thing. However, we shop them then based on price and product loyalty. And there is quite a bit of variation between plans, so do your shopping. There is a list of all of these companies at the Colorado Division of Insurance, and the premiums that they charge. We also have a link to that from our website at senioranswers.org. Medicare Part A just covers these 4 different things. So just to review, under Part A, it covers inpatient hospital care as well as mental health services on an inpatient basis up to 190 lifetime days. It pays the Part A, then there is a charge of the $1,600 deductible, the coinsurance, and the life insurance. The benefit, it will pay for semi-private rooms, although I think most hospitals have private rooms only these days. It will pay for meals while you're in the hospital, general nursing, any types of drugs that you need, and other hospital supplies. 2 things to know: if you are in the hospital as an inpatient, you have to get an advance beneficiary notice before you are discharged, and this has to describe the services that you are going to receive or that you are receiving. If the hospital believes that they are not going to be paid, they'll ask you to sign this advance beneficiary notice, and that means that you are liable for those charges. They also have to give you this hospital notice of non-coverage, which basically is the corollary to the advanced beneficiary notice, which says, these are the ones we think they're going to be covered. These are the ones we think are not going to be covered. And then they have to give you the important message from Medicare, which gives you your discharge date and appeals rights. Medicare Part B, as we said earlier, days 1 through 20 are free. Part A skilled rehab, 21 through 100 have a copay, no coverage after day 101. You can get some Part B services if you are in skilled rehab. The benefit then is you get the skilled nursing, all of the different therapies, rooms, meals, medications, any kind of ambulance transport, etc. And again, they have to give you notice. It's called a skilled nursing facility advance beneficiary notice before services start, tell you what it is. And it's usually a notice that's also given when they are getting ready to discharge. On the home care benefit under Part A, you do have to have the 3-day hospitalization. There's no charge for home care at all, but you do have to be homebound, meaning you need intermittent care for less than 8 hours per day, less than 28 hours a week for up to 21 days. You can get services again beyond that, but usually those are part of a Part B benefit rather than a Part A benefit. They also have to give you an advance beneficiary notice, as well as a home health change of care notice if services are stopped or started or changed, and they have to give you a notice of Medicare non-coverage at least 2 days before they discharge you. Under the hospice, you have to have a terminal diagnosis, and you have to have a life expectancy of 6 months or less, gets approved for 60 days. And then I get another 60-day approval and another 90 days. If you are on hospice more than 210 days and your condition is still declining, you can be extended beyond that. Hospice care is free, 5% charge for prescriptions, 5% for respite care. And if you have any room and board charges, if you're in a assisted living or a skilled nursing facility or a hospital, then you will have to pay the room and board charges. Hospice care focuses mostly on comfort care using a team of nurses and social workers, therapists, spiritual advisors, home health aides, and volunteers. They provide you all of the medical equipment and prescriptions. You can also qualify for respite care and family support, and they too have to give you a notice. So Part B then covers provider services, and this includes things like doctors and labs and x-rays. durable medical equipment, as I said, some home care, ambulance, and they do cover prescription drugs that are primarily infusions or drugs that have to be given in a doctor's office. So Part B, we'll look at the chart on the next page to see some of the different services that are included. As I said, Part B has a $226 deductible for 2023. Some services such as labs and x-rays are provided for no copay, and then some require the 20% charge. And some providers, especially physicians, have the option to charge more than the approved amount by Medicare. And if you have a physician who charges more than the approved amount, that is capped at 15% of the approved charge. So they can charge that additional. And that is one of the reasons I like Plan G under the Medicare Supplement, is that that is covered. In Part B, you do have to meet medical necessity, meaning that any treatment that you receive, the diagnoses and the treatment that is prescribed has to meet what the federal government has determined to be medically necessary. Medicare has an app called What's Covered, and you can put that on your phone. And so if you are at the doctor's office or whatever, you can actually check certain procedures if you have questions and see whether or not they are an approved Medicare benefit. And everybody, if you haven't figured out already, all of these different parts have to give you some kind of a notice of non-coverage. Anytime you sign a notice of non-coverage, you need to be aware and understand that if Medicare does not pay, you have just agreed to pay. And you could be agreeing to pay for a $20,000 MRI. So be very cautious about when you sign those notices of non-coverage. Sometimes the provider will say, then we won't do the service. And then you have to decide whether or not you're going to have the procedure done or whether you're going to take the risk that Medicare is not going to pay. A definition that Medicare uses of medical necessity is it says no Medicare payment shall be made for items or services that are not reasonable and necessary for the diagnosis or treatment of an illness or injury to improve the functioning of a malformed body part. Now that's a 1965 definition, and I continue to keep it. This is a list of all the different services that are provided by Medicare Part B. Some that I just wanted to make sure that people who are kind of new to Medicare know about. So preventive services, the annual physical, one time only in the first 12 months that you are eligible for Medicare. So either age 65 or when you take your special enrollment period and become eligible. After your first year, instead of getting an annual physical, you get what's called an annual wellness exam. It does not look like a physical. They're going to just look at your medications. They're going to look at your vaccines. They're going to talk to you about often your advanced care planning wishes. So they're probably not going to do much in the way of services at an annual wellness exam. I did do this little chart on preventive services just because there are a lot of preventive services that are provided by Medicare. The majority of them are free, however, free to you as the patient. There's no copay, but some of them have limits in terms of how often they are offered. So for example, a colonoscopy, they will only pay for once every 10 years, unless it is deemed medically necessary because you have a history or a suspicion of some cancer or polyps that they need to look at. But again, you can get a pretty wide variety of screenings through Medicare. They also will provide vaccines. And at this point in time, all Part B as well as Part D vaccines no longer have a copay. And this was part of the Inflation Reduction Act that President Biden signed a couple of months ago. So if you get the vaccine at the doctor's office, the community clinic, or the pharmacy, we advise it's okay to get pneumonia, influenza, or Hep B at any of those locations. However, your Part D benefit is only going to pay if you get it at the pharmacy for these three. So starting about February 1, shingles, both shots, the Shingrix should be covered at 100%, as well as Tdap and any COVID boosters that you may need. If you buy a Medicare supplement, you will also need to purchase a standalone prescription drug plan. If you do not buy a standalone prescription drug plan, there is a penalty of 1% per month for every month that you are not enrolled. So the 2023 Medicare Part D prescription drug levels or phases, and the deductibles and your copays are such. So there is a $505 deductible. It is the maximum amount. Some of the prescription drug plans this year are charging less, but a number of them are charging up to the $505. Once you pay out of your pocket the $505, then you go into level 2, which is your initial coverage determination. There you pay a copay or a co-insurance based on the tier of the drug. And then once your out-of-pocket costs plus the amount that the plan pays reaches $46.60, including this $505 over here, then you go to the third level here, which is the donut hole or the coverage gap. And when you're in the third level here, you will pay 25% of the cost of most generics and name brands until, again, the total cost that you pay plus what the company pays reaches $7,400. Then you enter this next level, which is catastrophic, where you pay 5%, or the Medicare pays 5%. I'm sorry, the plan pays 5%, and Medicare pays the other 95%, and you pay $4.15 for generics and $10.35 for other drugs. Now, some of the prescription drug companies, if you buy a tier 1 or a tier 2 drug, it does not count toward this deductible. And because a lot of people never get through their deductible, that is one of the reasons why the companies, the prescription drug plans, give you those tier 1 and tier 2 drugs that often don't count toward that deductible. Just a couple of facts about Part D. It is offered by private insurance company. The plans vary every single year. The formulas vary every single year. The premiums vary. So there's no way to get around that. They do have to cover 2 drugs in each therapeutic category. And they cover basically outpatient prescription drugs. Now, if you are in a skilled nursing facility, or if you are in an assisted living, your Medicare Part D will cover if you are not in a Medicare rehab bed. They do not cover over-the-counter drugs like cough syrups or vitamins and those kinds of things. And they don't cover cosmetics and that kind of thing. There is also a federal provision that requires that Medicare cover all drugs in these 6 classes. So they have to cover all drugs that are on the market for anti-seizure, antidepressants, antipsychotics, cancer drugs, HIV, and immunosuppressants. So they that is a little bit more expanded and helps people a lot. There is a new provision under the Inflation Reduction Act for insulin. So if you are an insulin-dependent diabetic, you will pay $35 per month for the first vial of insulin or pen that you receive. And then after that, there will be no copays and no co-insurance for any more insulin of, say, that type that month. If you have 2 types of insulin, so say you have long-acting as well as short-acting, you would have to pay the $35 each month for the long-acting and the $35 a month for the short-acting. But then after that, you should not have to pay anything for insulin that month. And then the next month, you'd have to pay again. The other thing is that they cannot charge you any charges that you for this $35 is not subject to the Part D deductible. Now, it's important to know that not all of the plans, the prescription drug plans, are participating in the insulin benefit. And if you are using the plan finder at medicare.gov, the guidance is that you put all your other drugs into the plan finder except your insulin, because it's going to be a standard amount, and you then add that to your out-of-pocket costs. The Medicare prescription drug tiers. So tier 1 is mostly generic drugs. Sometimes those are also on a tier 2. Tier 2 costs more, tend to be the preferred brand name drugs, and usually some preferred generics that are maybe a little bit more expensive. Tier 3 or sometimes tier 4 are non-preferred brand name usually, and the co-pays are usually higher for these. And then we have the specialty or tier 5 drugs. These are the most expensive ones. Oftentimes you're going to be paying on the tier 5 or the specialty drugs between 33 and 50% of the cost of the drug. These are the companies that are offering the standalone plans in Colorado for 2023. So if you are looking to enroll in a standalone plan, you'll want to enroll with one of these or continue coverage if you already have it. The Medicare Part D premiums. So as I said, you will have to pay $164 premium for your Medicare Part, that's for Part B. You also have to pay a premium for Part D, and the Part D premium, basically you pay what the plan charges, and then if your income as a single person is under $97,000 or under $194,000 in terms of your adjusted gross, then your premium will just be whatever is charged by the Part D plan. If you make more than that, there will be a surcharge up to $76.40 if you have, as a couple, have more than $750,000 adjusted gross income. Your out-of-pocket cost for the standalone prescription drug plan. The cheapest plan that I found in Colorado, as I said, was $3.20. It's a WellCare plan up to $129 per month, which is an ARP plan. Most plans, as I said, are charging the $500 deductible. And here is information on the tiers and the copays. And then this just summarizes the insulin that we just talked about. Now, it's important to know that supplies such as lancets, syringes, alcohol wipes can be charged to your Part B. So the important thing is to make sure that when you buy your diabetic supplies, that you buy them from a provider that is able to bill Part B. So for example, Walgreens can bill Part B, but King Soopers does not. So that concludes the portion of our discussion on Medicare supplements. Let's move to Medicare Advantage plans. So as I said earlier, Medicare Advantage plans are Part C, and they include A, B, and D. Medicare Advantage can cover things that Medicare A and B does not. So they have the flexibility, if you will, to do dental, eye, vision, or hearing, over-the-counter, podiatry, any type of additional telehealth, personal emergency systems. They also, in some ways, have low to no copays. They can have less out-of-pocket spending if you are a low user. Usually their deductibles look different than those in the Medicare Supplement, and their premiums are lower. What you do see is more out-of-pocket expense when you are using Part B services. So Medicare is basically oversees Medicare Advantage. That is not done by the Colorado Division of Insurance. So Medicare contracts with these insurance companies. So they contract with the Kaisers and the Uniteds and the Devoteds and the Humanas. They have to provide the same services, as I said, as original Medicare on the A, B, and D. Medicare also approves their networks and their marketing materials. So they have something called an adequacy of network, meaning that they have to have a certain number of providers who are accepting new patients. Medicare requires certain type of quality assurance programs. So they will, again, they oversee the kinds of services that are provided. They run various kinds of surveys, patient surveys. They do post-care reviews, etc. And you can change the plans annually. The insurance agents have to give you a disclosure. So the agents, this is a new requirement. So if you're buying a Medicare Advantage or a prescription drug plan, one of the things that the Inflation Reduction Act did is it says that agents and brokers now have to put on all of their marketing materials this particular disclaimer, which says we do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact Medicare.gov or 1-800-Medicare to get information about all your options. This disclaimer has to be included in the first minute of a sales phone call. So if somebody's calling you to talk to you, even if you have asked them to give you a call, they have to give you this disclaimer. They have to put it on all of their email and online chats and other electronic communications, put it on their website, put it on their marketing materials in 12-point font, and it has to be included in television ads. The second requirement that we have on sales calls for the agents is that all phone and Zoom calls now have to be recorded. So if a broker is calling you as a sales lead, even if they call you 5 or 6 times, telling you about more information or you're calling them back, every one of those calls has to be recorded. If they are calling you to schedule an appointment, they have to record it, as well as if they're calling you to get your list of drugs or who your providers are. They're calling you about education meetings, any kind of phone enrollments, and any kind of follow-up calls related to sales and completing the enrollment. So all of those calls have to be recorded. If you have an in-person meeting for a Medicare sales and enrollment, it does not have to be recorded. And if you are buying a Medicare supplement, it does not have to be recorded unless you are at the same time buying a Part D plan. But if you're doing those as separate transactions or with separate brokers, they don't have to be recorded. The Medicare Advantage company's role, so the company itself, they have to provide the original services, any additional services that they've negotiated with Medicare. That plan and that package is renegotiated every single year. Their services or their basic services stay, but then everything else can change. They frequently have to get prior authorization as a provider before the provider often has to get prior authorization before they can make a healthcare decision. And these plans are sold by agents and brokers. So there are 5 different types, primarily of Medicare Advantage plans in Colorado. We have HMOs, we have PPOs, we have private fee-for-service, special needs plans, and HMO point of service. The ones that we're going to talk about are these because those are the most frequent ones in Colorado. So the HMOs, which are the ones that you're probably most familiar with, you have to use their network. You have to choose a primary care physician. Usually the referrals are made to specialists by the primary care physician. They have to offer original Medicare, and they can add additional benefits, which most of them do. They have to include prescription drug plans most of the time. Once in a while, you find a plan that does not, but the majority of time they do. They specialize in offering chronic disease management and care coordination. And almost all of the companies that are selling in Colorado this year have at least one zero premium program or plan. So that is a very attractive feature, if you will, for some people. They are required to also have out-of-pocket maximums. So as an alternative to what we were talking about earlier with the Medicare Supplement, where you have the annual premium, plus if you buy Plan G, your Part B deductible, this is an alternative to that, where each company has to say what their maximum out-of-pocket is going to be. And this year, the majority of them are in the $7,400 range, although several of the plans went as high as $11,000 for their maximum. The PPOs, then, these are in-network providers, and as well as out-of-network. And you can, if you go to an in-network provider, usually you pay whatever the negotiated rate is. If you go to an out-of-network provider, usually the company does not pay, but you pay the 20% that you would pay if you were in original Medicare without any coverage. You do have the option usually to choose a primary care physician, although it's highly recommended. You can go out and network for specialists as well as other providers. Usually prescription drugs are included. And again, they specialize in chronic disease management and care coordination, and they too set maximum out-of-pocket maximums annually. The private fee-for-service is a little less frequent, often sold on the Western Slope. They have in-network providers, but you can go to out-network providers for additional charges. The one thing about this form or type of plan is that the provider can agree to see you on the fee that the insurance company is going to pay this month or this visit, but they don't have to agree to see you for all future visits for the amount that the company is willing to pay. They too include prescription drugs and chronic disease management. We have a new, well, they're not new, but we have a lot of companies offering these special needs plans. And the D-SNPs are basically for people who are on Medicare and Medicaid. The I-SNPs are for people who are in either assisted living or nursing homes. And the C-SNPs are for people who have chronic diseases if the company offers one for their disease. Membership is limited, so you have to meet one of those criteria. You have to be in a nursing home to do an I-SNP. And the provider that you are working with has to agree to accept Medicaid. Most of them have a zero premium, but some have deductibles and co-insurance. These are the companies that are selling Medicare Advantage plans in 2023 in Colorado. Now, not every plan is available in every county. So just because you want to get coverage from a company, it may or may not be available. We do have one company leaving the marketplace, and that is Bright Healthcare is leaving the marketplace. So if you are a Bright Healthcare Medicare Advantage individual, and that's where you've been receiving your health insurance for the last year or more, you will have to change. You can at this point go to use a special enrollment period, and you can go to a Medicare Supplement, or you can switch to one of these Medicare Advantage plans. Part C, some of the basics in terms of the out-of-pocket charges. They may have a monthly premium, or it may be zero. There's almost always a copay for visits to the doctor, specialist, the emergency room, urgent care, and inpatient. Now, the amount of the copay varies by company and usually the plan within the company. So if you get the silver, your emergency room copay might be $50, and if you get the gold, it might be $100 or whatever. You do have to pay the co-insurance for days 21 through 100 in a nursing home or skilled rehab. You usually have to pay the 20% for most Part B services or coverages for outpatient services. Prescription drugs usually have a copay depending on their tier, and most plans, as I said, have an out-of-pocket maximum. Again, that's a Medicare requirement. Some things that are different is that Medicare Part C usually waives the Part A deductible, meaning they don't charge you that $1,600. But what they do is that if you go into the hospital, for example, they will have, say, a $400 per day charge that you have to pay for the first 4 days that you are in the hospital. So you end up paying that $1,600 out of pocket in copays, where if you had a Medicare supplement, it would pay that $1,600 if you have a Plan G. Usually these Part C, they have negotiated these annual out-of-pocket caps. So again, you do know how much you are at risk for. As I said a few minutes ago, the average is around $7,400. The agency, which is a really good thing, can waive the prior authorization rules, but oftentimes they still are faced with having to get prior authorizations. If you have pre-existing conditions, usually if you are in a Medicare Advantage or a Part C plan, you usually cannot switch to a Medicare Supplement, and primarily because most people have pre-existing conditions. You can make that switch when you are first eligible for Medicare, whether you're in your initial enrollment period or your special enrollment period. You can try a Medicare Advantage for either 12 months or some portion thereof and retain your guaranteed issue in your Medicare Supplement. Medicare Advantage plans are rated by stars, and so every company has a certain number of stars. 4.5 to 5 are good. If you have a 5-star, you can enroll all year. Kaiser does have a 5-star and will be retaining that for next year. So we are at a point now where we are going to have to make a choice. Do we want a Medicare Supplement with a prescription drug plan, or do we want a Medicare Advantage? So basically, you're either on this side of the equation where you're going to buy a supplement. My recommendation, if you go that route, is to buy Plan G and then buy a Part D plan as well. Or you can buy the Medicare Advantage plan with, say, an HMO or a PPO and buy all 3 of the coverages together. Just by way of a quick summary, this is a comparison of Medicare supplements versus Medicare Advantage. There's nothing new in this chart. It's just a quick review, if you will. And when you go back and review the slides, feel free to take your time to review it. And that concludes the conversation that we're going to have today about Medicare Advantage and Medicare supplements and helping you to try to sort those out. I'm going to talk for a quick moment on other supports. So we at the Society do have a Medicare counseling toolkit. We can provide counseling in English or Spanish for enrollment in Part A, B, C, or D. We can help you understand Medicare supplements versus Medicare Advantage. If you have questions after this session, we can also help you with your annual plan review. If you want to put your prescriptions in the plan finder, and that can be done in English or Spanish as well. We have some other support services that we can refer you to health insurance agents for enrollment in Medicare Supplement, Medicare Advantage, or prescription drug plans. We are partnering again this year with the University of Colorado School of Pharmacy, and the students are going to be doing clinical reviews. So if you have a lot of medications and you want to know whether or not you need to, say, be taking all of those, whether some medications are working against each other, whether you just have general questions about what some of these medications do and whether you should continue them, there is a form that we will can make available to you if you call us, or probably in a couple of days you can go on our website and download it. And the reviews will be scheduled the last week of January or of October and the first week of November. We do record all of these sessions as well as many others on our YouTube channel, and we have information on our website on Medicare as well. If you would like to call us, you can call us at 303-333-3482, or you can call our toll-free number at 1-855-293-6911 toll-free, or our Spanish line is 1-855-880-4777. And these next 2 slides just basically talk a little bit about other services that we at the Gerontological Society provide. So I'm going to go to the chat real quick and answer any questions. I have a couple of minutes. We will be making the slides available to everybody